for a minimum of 60% of services and benefits. That's a 60% actuarial value plan. But that 60% is after you've hit your out-of-pocket maximum. It's not first dollar. If it's not that level, that robustness of a plan, then you can opt out and look at the premium tax credits on the marketplace. Or if your employee share of the premium for an individual plan exceeds 9.5% of your household income. So it means that if my employer is offering me an individual plan and what I need to put up for premiums is more than 9.5% of household income, then I can opt out if it's not affordable to me. There is an employer coverage tool. Again, there's that healthcare.gov. We talk a lot about it because a lot of the resources are on that website. And in terms of how much tax credit people might be able to get, it depends on these factors. So again, we talked about the fact that it's going to depend on your household income. It's modified adjusted gross income from your taxes. It's as a percentage of the federal poverty level and family size. And it's also going to be based on, this all sounds like, it sounds very confusing, and that's why the navigators will help people walk through it. But we just like to let people know kind of how it works. The premiums for a robust middle-of-the-road plan is going to be the second lowest silver plan in the state. It's referred to as a benchmark. And then for incomes between 100 and 400% of the federal poverty level, what the government deems affordable increases from, they expect you to pay 2% of your income at 100% of the federal poverty level, but at 400% of the federal poverty level, they expect you to pay 9.5% of your household income. So what does that really look like? Here are some numbers, and again, this is for an individual, okay? So with the family numbers would be different. If you're, say, I think the best way to kind of understand this is if you are at, say, 200 to 250% of the federal poverty level, say you're making $25,000, and we're going to just take numbers from the middle. The premium contribution as a percentage of your income might be around 7%. So maybe you're going to be having a monthly premium contribution of, it's saying $160 would be what you're going to be responsible for. But that silver plan would cost you $360, okay, in terms of a month. They're going to tell you that your subsidy eligibility is $200 a month, okay? That $200 a month you can choose to pay on a bronze plan, a silver plan, or a gold plan. And those are different levels of actuarial plans. So these are the categories of what the different plans that you can choose. So they are defined by, and you'll hear these metal levels. People will start talking about gold plans and silver plans and bronze plans, and you'll see on our list of plans that these differentiators. And you have to think about this as an average. So a bronze plan, typically, if you hit your out-of-pocket limit, is going to have paid 60% of the cost would be paid by your insurer, and you're going to end up paying 40% of those costs. Lower premiums in these bronze plans, but you're going to end up paying more as you utilize the plan, okay? If you move to a silver plan, 70% of the costs are paid by the insurance company. You're getting a little bit more, but your premiums are going to have come up. If you go to a gold plan, again, a little bit richer plan in terms of utilization, but your premiums go up again. So people are going to be able to make choices around these